Welcome to our next video in the Medicine in Britain series. This time we are looking at the care options available to the sick in the medieval period. First and foremost, if you were sick, you were cared for at home by women. To go to see a professional cost money and could be incredibly painful, so people did not always want to visit someone unless they absolutely had to. So let's look from the top end first. The cream of the medieval medicine crop was the physician. Often visited by royalty and the very wealthy, these were well-trained individuals who obtained a medical degree from new universities including Oxford and Cambridge. The physician did not treat patients as such, but did diagnose them. Physicians would first look at the urine samples of the patient. This may be accompanied by poo or blood samples. The urine chart was consulted by looking at the colour and consistency of the urine. The urine was also smelt and in some cases tasted to work out what was wrong with the patient. After this, the physician would consult star charts to look at what was happening in the heavens when the patient was born and when they started to become unwell. Once this was done, the physician would recommend a treatment. They would not do this themselves, but let apothecaries and barber surgeons carry out the treatment. Most physicians were also trained priests, and the church forbid the drawing of blood, which meant that treatment had to be carried out by others. Next down the ladder of cost and skill were the apothecaries. They were skilled individuals who were very knowledgeable about plants and herbs and mixed the remedies and mixes that people needed. There was some education involved, but in many cases this was passed down knowledge from generations within families. Apothecaries were much cheaper than a physician. At the bottom end of the ladder were the barber surgeons. As the name suggests, they were barbers who cut hair and demonstrated skill with blades. If a patient was lucky, they may have a barber surgeon who went away to war and picked up some skills. However, as time passed, surgeons did get more training and became very skilled. Surgeons could remove limbs, bleed a patient, and tidy up wounds which had been sustained. Those are the options for the sick. However, you may have noticed that we have missed one crucial area which we take for granted today: hospitals. By 1500, there were over 1,000 hospitals in England, and many were run by the church. Some of these hospitals looked after lepers, but most did not actually treat sick people. They provided hospitality for travellers and the elderly. The hospitals were kept clean and regular washing was key. Bed sheets were clean and people in them received food and drink. Monks and nuns worked in the hospital and looked after both the physical and spiritual needs of those in the hospital. Nuns would do the nursing and priests would offer masses for the patients. So in summary, if you needed help in the 13th century, then you found it at home, looked after by the women in your life. If you could afford it, you went to a physician who diagnosed you, or visited an apothecary to get remedies, or if you wanted to stomach the pain, you could head to the barber surgeon for a good bleeding. Hospitals existed, but not as we know them. They cared for the old and infirm and were run by the church. And with that, my loyal compatriots, that was a little bit of history.